Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. It's good to be here tonight. It's Tuesday, and this is the 74th talk, and it's going to be on assessing the impact of the videos and podcasts on the public. And I've done a study of the comments that people have written in and used that as a guideline to see how people are using the channel. And I see two patterns, actually. People use the channel to learn about psychotherapy, and that's both professionals and also people beginning their studies, like psych major in college. And also people use it for inspiration. So, first example, student, right, he's studying his BA in psychology, and he says that the videos on intervention, particularly on silence and as an intervention, was very helpful. He didn't think that he didn't think about silence as an intervention. It is a concept that's only talked about, well, I wouldn't say only, but mostly in the modern psychoanalysis. So Mel writes in and he said, "This is it's like taking a graduate course." He's a psychologist. A woman from Vienna, Austria, she wrote in and she said she's using the YouTube videos in order to write her book on psychotherapy, and what she's using from the videos is the personal stories. And I do have some personal stories when I talk, and she's using that idea to write her book on psychotherapy. Here's one that comes in from somebody who says he likes the videos because they challenge myths about psychotherapy, and the videos make psychotherapy accessible to the common person. That's what the mission actually is, breaking down psychotherapy so it can be understood, and it's often been described as authentic and down to earth. Here's a 46-year-old man that writes in. He's looking to study. He's starting his BA in psychology. 46 years old. That's impressive. And thank you very much for telling your story about being a bipolar. You say he was diagnosed as bipolar. And also he was diagnosed with dyslexia. And yet he's going to school, he's starting up. And what he was saying was those things have interfered with his being more involved in school, but now he's starting up and he's forging ahead. Good for you. Oh, here's somebody else who writes in about the techniques of psychotherapy. Learning the techniques inspired him in his work. We talk a lot about techniques throughout the 74 videos here and there. Rebecca, she's 12 years old. Now, Rebecca writes me and she said, "I like your videos. Listening to your videos makes me want to be a therapist." 12 years old, that's very unusual. Age bracket, 12 years old. And what she liked was, she said, I think how she put it, I was connecting with young people, and like herself, and giving them an option for another career to think about. A 64-year-old woman writes in that watching the videos of Dr. Lucas and myself motivated her to go back into the field of psychotherapy. She had been out of the field for quite some time. As you know, Dr. Lucas is my psychoanalyst, and we shared a lot in the videos together, and she was watching them and brought her right out to go into practice again. That's inspiration, motivation. Here's from Australia. This woman was a counseling class, and this is more in the beginning of the videos, toward the 2012 end, I think. And she said, Dr. Rousseau, wonderful Dr. Rousseau, is playing your videos in our class in Australia. That was very interesting. I didn't expect something like that. I think that was the first one that mentioned that the videos were being played in class. Yeah. And also Dr. Rousseau I found on LinkedIn, and he's come quite a ways since being a professor teaching counseling. Yeah, but I wrote him on LinkedIn and I said, by the way, do you ever remember a woman, a girl, student in your class, and she well, that's why when I wanted to ask, did you play videos in your class? Just wanted to check it out, and he said, yes, I did. Yeah, that was a long time ago, and now he's into a whole different advance in many different things beyond counseling. Eric Williams. Now, Eric Williams was a teacher at Rutgers School of Social Work, and he wrote me saying that he was playing the videos in his class, social work, and they had a very strong positive reaction to the videos. And he played them apparently for some time in that semester, I guess it was, in teaching social work students. That was heartening for me to hear that, because of course, my background, as you know, is social work, and then I went on in my master's of social work, and then I went on to get my PhD in clinical social work. And I actually, did my thesis there, and it was very important to me because I had it published. So Eric, we became very friends, and he made also a comment about the videos that he watched with Jerry Lucas and myself, and he said they were very moving and very warm. And what he noticed was that he was hesitant about even making a comment about the videos because they seemed so personal between us. But he did eventually make a comment. He made that comment about how our relationship was so wonderful to watch and develop. Now, Dr. Lucas, as you know, he was my analyst, and he died a few years ago. He had dementia toward the end of his life, and I had to stop seeing him. But I also continued to see him every Friday, and I would go to his house, and we call it Mark and Jerry's Day, and I'd take videos of him, and he enjoyed that. We'd go for walks. We went to that place, Barney Greengrass, up on, I think it's Columbus and 87th Street. And we would go there for lunch. And sometimes, one time I told the waiters that it was his birthday, and everyone sang "Happy Birthday to you." That was really nice. He was very surprised. He liked the videos. Yeah, we used to watch them together. And I will tell a little bit about the story of Dr. Lucas a little later on. Somebody wrote in, the videos are like a breath of fresh air. That was nice. I mean, I mean to be contributing something new, not like other videos, whatever that means, but they're certainly they're not TED Talks. So they have been described, as I said, as authentic and down to earth, and many people have described it that way. So this person was referred to the site by her university, and she said that the talks were so fresh and new. I'm not sure which university. She didn't mention it in her writing. Somebody else writes in, and she said, I was listening to the introduction. Now, in the introduction, there's the quote, "It is joy to be hidden and disaster not to be found," from D.W. Winnicott, and that I use that to frame all my YouTube videos and podcasts. So she said, watching that, she said, I learned it was okay to hide. Isn't that interesting? You never know what somebody's going to learn from watching the videos. So she learned to protect herself. Obviously, she didn't know that it was okay to hide. And many times we'll find that from people who can be taken over and abused by people because they can't defend themselves, they can't say no. And also sometimes children, if they have a secret, and the parents, the caregivers may want to know what that secret is, and they might push them to reveal it. Well, the child really forms its identity and its strength and separation between the self and the caregiver by saying, I'm not going to tell you. It's a way to know that they can have information that the other person can't have. So it builds up their own differentiation from the other person who's trying to know by knowing something that they don't know. It's a lot of strength, but sometimes parents interpret as an insult or whatever. So, but she said, I learned it's okay to hide. And again, I teach people how to hide if they need to learn that, and also the rest of it to help people become authentic. Because it's very hard to become authentic, because people often feel like if you really get to know me, you're not going to like me. So that's the tension in the needing to hide and also needing to be known. And that's really, to me, intimacy is really being known by the other. So a word about Jerry Lucas. I found this later on, after I was doing the videos for a while, that he didn't have much exposure at all, and he liked it when he got the exposure. And I was giving him exposure to the world by putting him on internet, but it reminded me of my father, because my father was always criticized by my mother because she didn't think that he did enough in his life. So she felt that he could have done more, and he fell under the gun of her criticism, and sometimes I would see him look down at the table when she was remarking about his deficiencies. He was a very bright guy, a very good writer. He could have done well, but he didn't push himself to that. He worked for a newspaper in Albany, but not in the writing section. He was working for the taking ads and when the people called in. So finally, I got under out of the shadow of Dr. Lucas and my own person, but he certainly taught me a lot. Taught me how to fight, to say no, talking about saying no. At one time when I went into his room and I didn't feel like laying down on the couch, and I just stood there and he stood there and we stood there together, and he didn't make a sound. And then when I was ready to go, I went to the couch and we resumed our sessions. But he didn't criticize me. He asked me why I did that. He's a very strong man. I need that for a while. For 16 years I studied with him. He was one of the best teachers in modern psychoanalysis. So that was Jerry Lucas. And I think a lot of people have contributed, to my growth and development. A lot of my patients have, and I want to thank them all for being able to be courageous and take a chance and talk about themselves openly and frankly. It's a very difficult thing to do for a person to come into therapy, because they've been criticized and scolded and sometimes beaten severely. I had one person walk in a few months ago, and he was hit with a belt by his mom if he didn't know the right answer. So people have tremendous things that they bring to therapy, and I really admire them for being able to come here and talk so openly eventually, but not in the beginning, because they have to develop trust in the relationship that they're not going to be thrown out or scolded for who they are. And that's what people do. They come in and they protect themselves, and I help them protect themselves more if they need it. Like some people will spill their guts out, and I have to slow them down, because if they say too much about themselves, they'll walk away and never want to come back because they feel shame. I know people carry a lot of shame within them. So, yeah. So the videos showed me that people were getting inspiration from them and also learning a lot. And the people who played the videos in their classroom, I didn't expect that. That was a nice surprise, and I like to be surprised like that. And the first one was that woman in Australia, and then the next one was Dr. Eric Williams. Now he's a doctor, and he started out, he's finishing his doctorate at Rutgers, and he's Dr. Eric Williams now. Yeah, so that was, and then there was somebody else who played my videos in Malaysia. That was an interesting experience in Malaysia. I mean, how far is 9,700 miles away? 16 hours on a plane. But with the technology that we can carry the message about our thoughts about therapy to people all over the world. And this person, I was telling him about my videos that I had, and I wrote him because he just seemed to be a very interesting guy, and I wrote him and I said that some people in schools and universities were playing the video, so he was interested. So he looked at a video and he said he'd like to play video, the first talk, the first one I ever did. So he took that video and he played it for his class. And I asked, by the way, is there any chance I could get the results? And he said, sure. So he had 30 people in his class. He's teaching psychotherapy. So he played the video, and then he asked them questions about the video to answer. So he sent me all the responses. It was amazing. He was such a a giving person, and wanting to participate like that and share things with me. Different culture, like Malaysia is a good portion of Malaysia's Muslim population. That was nice to be talking to somebody from a different culture. And he was a great guy. He is a great guy. And so we still communicate. And the students sent all in their reactions to the videos, what they were learning. Like they were learning to, it's very important to establish a relationship with a patient. It's very important not to ask too many questions, personal questions, unless the patient is ready. They learn what the intervention of silence really means and why it's important. How important it is not to be judgmental and critical. Of course, now we would take that for granted, but many people just have judgments within them, so they have to work on them as therapists to become better therapists and less judgmental of themselves. So they were very astute. Yeah, all 30 of them wrote back. So I have all those. I'm going to keep them, and can still communicate with Dr. Yusuf. Yeah. So there's another thing that I think about doing things differently in therapy. Well, this is not so different, but one person came to me, and I've spoken to you about her. She was physically abused, sexually abused from another country, and she watches some of these videos that I don't. She's very comfortable. She made so much progress. I'm really amazed at her ability to hang in there, because to come to another therapist after she's been abused. So the only reason she came to see me was she saw the psychotherapy videos, and she made a connection and called me. We talked on the phone for a while, and then she came to see me in person. She wanted to see me in person, and that was a remarkable day, because she was so scared, rightly so, because of the experience that she had prior to coming to see me in person, that she couldn't come into the office. I had to go outside. I had a gate on my on my office, on the entrance. So I had to go out, get her, and ask her to come in. And the whole therapy session she was silent, and understandably so. She didn't know. She was frozen. She was petrified. Really. So it was good for her. She had the courage to come in. That says a lot about her, as I got to know her more. And so she came back 6 months later, and she was talking very freely, talking. Amazing. Yeah. And now she gives lectures. She's written material in the field and in her field. And she's done remarkably well. Also, one thing that happened with her lately was that she wanted to read to me a story about the death of her good friend, and so I did. She read it to me out loud, and so she cried, and she mourned in a way that she never mourned before, because she wasn't capable at that time. So remarkable. And my doing it with her was very important, because as a child she was very alone and not appreciated by her family. They didn't really want to have her. So she had a lot to contend with, but by doing it with me and going through the tremendous emotional grief of, again, revisiting that loss of a friend, she did remarkably well, and I learned a lot by just doing something that was new for me to do. She was She was one person who was so in tune when Dr. Lucas died a few years ago. And she said to me, she said, "You must be heartbroken." And she was hit it right on the head, you know. She really knew and understood. And it was very nice to hear that. And she sent me some chocolate-covered strawberries a couple of times to around the time that Dr. Lucas died. So, yeah. So many things are very satisfying in this work, to see people grow and become themselves. And that's what I like most about the work. People can grow, become themselves, reveal themselves, become authentic. And for the most part, they do trust me. I mean, they keep coming to see me for a long time, and people need to come for a long time because they've been so damaged, emotionally damaged. So, yeah, so I have a group. They're wonderful to work with, group therapy. And they've been coming for a long time. I think the oldest person that have seen me in the group is not 30 years old by a long shot. Groups don't usually stay that long, but I mean, the group has been with me for quite some time. But she is the oldest patient in the group because I have been seeing her for 30 years. And she's remarkably done so well. She raised a child, and on her own. That child is a doctor and has 2 kids. Wonderful. And she grew up with poverty, and it's a very, very difficult life. And now she's a beaming person who's so delighted that she just got a new job, and it's a fantastic job and the best one she's ever had. So talk about therapy working. And then I have my psychotherapy training group too, which has been with me for 7 years, and they are really try hard to be as authentic as they can, and because the task in the group is to if you can say everything in the group, you don't have to be worried about your working with your patients. The reason is that whatever you can't say, you can't help your patients say. So they're very open in the group, and as I said, 7 years they've been with me. So it's terrific for me and for them. I struggle with them sometimes, and they struggle to talk, and sometimes I struggle too. So I'm going to end right there for the 74th talk on assessing the impact of psychotherapy videos and podcasts. So I'm going to sign off, Dr. Mark Sehl, for the YouTube channel Therapy for the Heart. And if you go on SoundCloud.com and you enter Therapy for the Heart, you'll see a big heart. Click on it, and you can follow it there. And also the YouTube. Please make a comment if you can, if you have a Gmail account. And I do have the additional page now. Well, it's the old page, but I renamed it. It was viewer comment page, and it's now called Friends of Therapy Heart, Friends of Therapy for the Heart. And if you go to Mark Sehl at marksehl.com, and you get the pull-down menu, and you can find psychotherapy videos, and then you'll come to the page where you can read other people's comments. So, and yours if you put them in. I always ask permission, and so that's it. I'm going to sign off right now for Mark Sehl, and it's Tuesday, so it'll be up most likely sometime tonight or tomorrow. And the podcast was also up earlier on this evening. I put that up around 7 or something like that. So, okay, so adios, and I'll see you soon. Right, bye-bye.